But even in doing that, isn't it true that investments in some of the things you mentioned, equipment, structures, maybe facilities, you know, these investments, isn't it true that they must come along investment in affordable access, you know, for there to be significant impact? People need to be able to afford this treatment for us to see, yes, truly we're making inroads and making headway here.
Okay. So I think you are very correct in that. And that is another area that we'll have to commend this government. The government of His Excellency Bola Tinubu under the under the stewardship of Prof. Muhammad Ali Pate, the Honorable Minister for Health and Social Welfare, have hit this, and they are currently working to procure 6 brand new cancer treatment machines as an addition to the 6 tertiary hospitals that we have in this region. This has actually it has reached an advanced stage. And you can see before the advent of this government, I think we have there about, if we can say LINAC, we have there about 4 or 5. And hardly will you find like say 3 or 4 working. So at the first dispensation of this government, 6 brand new equipments were given awarded contract to supply, which we hope to actually see the supply and the completion of the bunkers that will house this machine by by the second quarter of this year. So that alone, you can see, is like there about, let's say, 100% increase in the amount of cancer treatment machine in the country. And once we have that, it's like we are improving access, the availability through providing the needed services. Now, the second thing that you talked about is the affordability of the service. While we know that it's cancer service, cancer treatment is capital intensive globally. it's capital intensive globally. Again, we have to commend this government, because there is what we call the National Cancer Health Fund. It is an initiative of the government where indigent patients are supported to actually be able to afford their treatment. And this very important fund is now under the National Institute for Cancer Research and Treatment. Initially, it was piloted to cater for all the 3 cancer cases because of the amount of funds that we have vis-a-vis the breast cancer, prostate, and cervical cancer. And it was piloted in the 6 cancer centers of excellence that we have. That is 1 for each region. But with the coming of NICRAD and the transfer of this very important fund to NICRAD, we are currently working in phases to expand the services to not only the centers, but virtually all the centers, our tertiary hospitals that provide some form of cancer treatment care. We divided the whole country and the hospitals that we have into the feeders, sub-hubs, and hubs. Our primary healthcare centers and some general hospitals within the rural area will serve as the feeders, where if some cases of cancers are detected, they can be referred to sub-hubs. And sub-hubs are equipped to perform some form of surgeries, but sometimes some cannot give chemotherapy or there are no radiotherapeutic services. Then from there, once the surgery is done in this general hospital, the patient can be referred to the hubs. And this hubs is where this Cancer Health Fund is actually situated. So through this robust referral system, we will be able to support virtually all the Nigerians that have this cancer patient. We are engaging the National Assembly to improve or increase funding of this Cancer Health Fund. I've engaged several important personalities, and they have assured us that we're going to have more funds in that cancer health fund. So it's actually a very good thing for the cancer patient in the country. We also hope to reach out to philanthropists in the country to support in putting some funds into some funds, because as we have earlier mentioned, cancer treatment anywhere is capital intensive.